Over the last 24 hours, we have identified 2,722 new cases of COVID-19 and completed about 6,700 tests. The positivity rate is about 42.8%. Sadly, 13 new deaths have been reported to Alberta Health over the past 24 hours. There is now a new option to treat COVID-19 after someone has been infected. In addition to the monoclonal antibody we have been able to offer to Albertans for several months, last week Health Canada approved Paxlovid, a drug that can treat mild to moderate cases of COVID-19. As you heard, starting Monday, January 31st, we will be able to offer it to a limited group of Albertans. We have established the current eligibility criteria to ensure that those who are most at risk and who have no contraindications are able to access this treatment in a timely manner, helping to reduce the risk of COVID progressing to a more serious stage. The criteria include immunocompromised individuals age 18 and over, regardless of their vaccination status, who have received transplants, who are cancer patients and have received chemotherapy or another immunosuppressive treatment in the past 2 years, or who have an inflammatory condition that they are being treated for, such as rheumatoid arthritis, lupus, or inflammatory bowel disease. Paxlovid will also be a possible option for Albertans who are unvaccinated and over the age of 65, or age 18 or older with a pre-existing health condition, such as diabetes, obesity, chronic kidney disease or obstructive pulmonary disease, or congestive heart failure. In addition to meeting one of the criteria I have just mentioned, individuals must have a confirmed case of COVID and be within 5 days of when they first experienced COVID-19 symptoms. Individuals who meet these criteria will be prompted to contact HealthLink when they receive their positive results for an initial evaluation of eligibility. In Alberta, we have looked at the available evidence with respect to the impacts of masking in community and again looking at settings where there have been a small number of community randomized controlled trials done that looked at the impact of medical masks in particular. And those are the medical grade surgical type masks that showed reductions in infection rates. We've also looked at our own data with respect to in the fall where we had masking in some schools and not in others. We did observe differences in outbreaks in schools where masking was not in use as opposed to schools that it was in use. So we have that observational data available from our own experience in the fall. I would say that all of us are very keen to get back to more of a normal situation for ourselves and our children, but we also know that COVID-19 is still a threat, that transmission is still high, and that while children, and especially kids in the younger age group, that 5 to 11 group, are at individual lower risk of severe outcomes, that risk is not zero. And those kids can also take COVID-19 if they get infected home to their families. So unfortunately, we must continue to use the interventions that we know have an impact and get through this current wave before we can consider how we can cautiously make decisions that help us get back to more of a normal approach while at the same time not putting people's health at jeopardy with direct COVID impacts.
I am hopeful that the number of cases are on the downslope. But as we said today, hospitalizations are continue to rise. All going well, we'll see those, in the next few weeks. They'll start to come down, and I think the Premier said this before. We can start looking at reducing restrictions once we see a sustained trend in a reduction in cases and a reduction in hospitalizations. I fully appreciate that people are tired. We went from the fourth wave, very modest changes to restrictions. And then we had to increase them to manage through the fifth wave. Now, again, I'm hopeful that the cases are cresting and coming down the other side, and we'll see in a couple of weeks that in our hospitals. But right now, we need to continue to focus on following the restrictions. Staying home when you're sick, wearing masks, getting booster shots to get through this. See the hospital numbers come down, and then we can take the next step.